Mr. Phillip, I want to discuss some potential complications associated with the upcoming surgical procedure. While most surgeries are successful, there are always risks involved.
I understand, Dr. Mihira. I want to be prepared for any potential challenges.
One possible complication is bleeding. This can occur during or after the surgery. We'll take precautions to minimize the risk of bleeding, but it's important to be aware of the possibility.
What are the signs of excessive bleeding?
Signs of excessive bleeding might include dizziness, lightheadedness, or difficulty breathing. If you experience any of these symptoms, please notify the nursing staff immediately.
Are there any other potential complications?
Another risk is infection. We'll take steps to prevent infection, such as using sterile techniques and administering antibiotics as needed. However, there's always a risk of infection, especially in surgical procedures.
What are the signs of infection, Dr. Mihira?
Signs of infection might include redness, swelling, pain, or drainage from the incision. If you notice any of these symptoms, please notify your nurse immediately.
Mihira, I want to talk to you about your treatment plan for end-stage renal disease. It's a lot to take in, but we'll work through it together. The goal of this plan is to help you feel your best, manage your symptoms, and keep you out of the hospital as much as possible. It involves several key components, and each one is crucial to your overall well-being. First, let's discuss your medications. You'll be taking a combination of medicines to manage the complications of kidney disease. Some of these may include medications to control your blood pressure, which is vital for protecting the remaining kidney function. You may also be prescribed medications to manage anemia, a common issue with kidney disease, and others to control the levels of phosphorus and other minerals in your blood. It's really important to take these medicines exactly as prescribed, even on days you feel well. Skipping a dose can disrupt the delicate balance we're trying to maintain in your body. Next, we need to focus on your diet and fluid intake. This is often one of the biggest changes for patients, but it makes a huge difference. Your diet will need to be low in protein, sodium, potassium, and phosphorus. I know this sounds restrictive, but we can connect you with a dietitian who will help you find delicious and healthy meals that fit these guidelines. We also need to talk about fluid restrictions. Your kidneys aren't able to remove excess fluid from your body, so it's essential to limit how much you drink. This helps prevent fluid buildup, which can lead to swelling, shortness of breath, and high blood pressure. Finally, a cornerstone of your treatment plan will be your dialysis schedule. Dialysis acts as an artificial kidney to filter waste products and excess fluid from your blood. Following your scheduled sessions is non-negotiable for your health. Missing even one session can lead to a dangerous buildup of toxins and fluid in your body, which could result in a trip to the emergency room. We'll work with you to create a schedule that fits your life as much as possible, whether it's hemodialysis at a clinic or peritoneal dialysis at home. I can't stress enough how important it is to stick to this plan. Adherence is the key to preventing a further decline in your kidney function. Your kidneys are working very hard, and by following the medication, diet, fluid, and dialysis plans, you're taking the burden off them. This helps minimize your symptoms like fatigue, swelling, and itching, allowing you to have a better quality of life. Most importantly, it will significantly reduce the number of hospitalizations you may need in the future. We're a team in this, and your commitment is the most important part of keeping you healthy and thriving.